Hello, in this video we're going to be looking at some of the landmarks of the skull. We use the landmarks of the skull in radiology to measure for central ray placement for different images of the skull, cranial bone, sinuses, mandible, all of those different structures. So let's start at the top here, this green shaded area here. This green shaded area here at the top is called the frontal tuberosity or frontal eminence. It's a rounded prominence that sits above the supraorbital grooves. Now, the supraorbital grooves are not labeled in this particular image, but the supraorbital grooves lie right in this area here. And you can palpate for your supraorbital grooves by taking your finger to your hairline, running your finger, down your forehead, from the hairline down toward your eyebrows. Now, a little bit before you hit your eyebrows, you'll feel a little bit of a groove, a little indentation there anteriorly on your skull. That's the supraorbital groove. And then when you hit your eyebrows, we have the bony part of our orbit, right, just superior to where the orbit sits, is called the superciliary ridge or superciliary arch. Now they've highlighted that for us. So we could say that between the eminence and the groove, between the eminence and that superciliary ridge that literally sits underneath your eyebrow, you can feel it by rubbing your eyebrows. The groove sits just between those two landmarks, all right? So the frontal eminence or tuberosity, and then we would have the supraorbital groove that runs, all of this is part of the frontal bone, right? And then just below the supraorbital groove, we have what's called the superciliary arch or ridge, and that is just below our eyebrows. Then another thing that is not labeled here on this picture that we'll also learn, that we need to know and learn, is the supraorbital margin. So I'm going to turn it around so you can kind of get an idea of what's happening here. So that superciliary ridge is right on the edge of where that orbit is going to sink into the socket, right? Where the eyeball sits. So that's what we call the supraorbital margin. I'm going to tip him up a little bit. This is what we call the supraorbital margin. All right, so we have the eminence or tuberosity, the groove, superciliary arch or ridge, and then the supraorbital margin, which is kind of like the roof of the skull, of the roof of the orbit, basically. And we'll be looking for that. We'll call them the orbital plates or the orbital roofs when we're labeling them on X-rays. So we need to understand where that sits in the skull. From a lateral view, kind of an oblique. You can kind of see it in here. Tip the head back. You can see where that margin of the orbit is. Supraorbital margin. All right. Okay. Now I don't think that we have utilized the Nasion just yet, but we are going to be utilizing the Nasion landmark a lot in imaging of the face and skull. The Nasion is where the nasal bones articulate. We have a right and a left nasal bone, and where they articulate is called the Nasion landmark. So we'll be measuring from that Nasion landmark. But if I turn the skull a little bit here, you'll see it's where the bridge of the nose would be, because we have our nose is mostly articular, is mostly cartilage, and our nose would protrude out further. The nasal bone is a very small bone. So in this area right here, the bridge of the nose is what it would look like on our patients. That's where we would be able to find the Nasion and measure for central ray placement on our patient's face. Now the next one we're going to look at, you guys are already familiar with. We use this for C-spine positioning. This is the anterior nasal spine. And this was where we had the AML, right? The anterior and acanthomeatal line. So the structure itself is called the anterior nasal spine, the bony structure. The landmark, we call it the acanthion. So remember the AML that we used to use, right? And here is our EAM, external acoustic meatus. All right, so you can see that was that line we were drawing for the acanthomeatal line. Now we'll have, you know, many other lines to learn for our skull positioning. All right, so working our way inferior from that anterior nasal spine or acanthion landmark, we have the alveolar processes, right? So we have an alveolar process of the maxilla and an alveolar process of the mandible here. So we'll be talking about those alveolar processes a lot. The alveolar processes are where the roots of the teeth are embedded in either the mandible or the maxilla or the mandible. And then just below the alveolar process here on the mandible, inferiorly, we have the mentum or the mental protuberance or mental point. We've been using that one. We use that for Fuchs and Judd positioning on the C-spine. These little guys here are foramen. They're called the mental foramen. I guess they're, just referring to the mental point on the mandible, the mental foramen here. Just below the orbit itself is the infraorbital foramen. Infra meaning below, infraorbital foramen. All right, so let's just go through it one more time. We've got the frontal tuberosity or eminence. Then just below that, we'll be able to feel that groove. It's bigger on some people than others. Some people you can actually see their groove when they turn sideways, like from a lateral view, you can see their groove. Other people, it's not as prominent, right? So we have the supraorbital groove, then the superciliary ridge or arch, and then the supraorbital margin, okay? Then we hit the nasion, right? The bridge of the nose. Then we have the acanthion landmark at the anterior nasal spine. That's just right there at the Cupid's bow, right below the nose, where the nose and the lip come together, right in between the nose and the lip, the end of the nose and the lip. Then we have their alveolar processes here and here, right? And then the mental foramen and then our infraorbital foramen, all right? So let's look at some stuff from the lateral view. Oh, and the mentum, let's not forget the mentum, okay? All right, so now let's turn it in a lateral view and look at some things, all right? So now we got that EAM again, that beautiful EAM. We discussed the mastoid process, or we use the mastoid process, I should say, to to palpate, to find the base of the skull. So that's utilized in C-spine positioning as well. They have this area right here. This bone is the temporal bone. This is the squamosal suture of the temporal bone, and this is a process that projects anteriorly from the temporal bone. It's called the zygomatic process of the temporal bone because the process is named by the bone that it will articulate with. So the zygomatic process of the temporal bone will articulate with the temporal process of the zygoma. These two processes, you see where they come together here, where they articulate, serves to make up the zygomatic arch, what we call the zygomatic arch. So in X-ray, we do images of the zygomatic arch. So this would be specifically the zygomatic process of the temporal bone. It's part of the temporal bone. This part here, this part would be the temporal process of the zygoma or zygomatic bone, right? Both of those together help to form what we call the zygomatic arch. And we have, a right and a left zygomatic arch. All right, let's see. So now there's this big dot right here. This is called the pterion. This is a junction where the sutures come together. As when we start looking at pediatrics, we're going to see that the sutures are not completely ossified as a baby because we need room to grow. So where those sutures finally ossify and come together, we call them junction points. So this junction point where the squamosal suture and the coronal suture, this is the coronal suture going across the skull, that is called the pterion junction point. Let's turn the skull around posteriorly. Look at our occipital bone here, all right? So this junction point is called the lambda because it's where the lambdoidal suture, this is called the lambdoidal suture, comes together with the sagittal suture going down the middle of the skull, okay? So this is called the lambda junction, right? So then we have the sagittal suture here, right? This is the vertex of the skull, the very tip top of the skull. So let's see if we turn around. It's like the top of the skull where it sits the highest really is the vertex. We do images called submental vertex where our central ray will exit the vertex of the skull. Right, then here we have, let me just kind of turn them around a lot here. Let me tip him forward so we know we're looking at the front. All right, so this is where the coronal suture and the sagittal suture meet here, and that is called the bregma junction point. All right, so we have the pterion, squamosal suture, and coronal suture. We have the bregma, sagittal suture, and coronal suture, where they come together, and the lambda, where the lambdoidal suture and the sagittal suture come together. We also have junction points that they actually did not list they didn't put the asterion, the junction where the lambdoidal comes together with the squamosal posteriorly here is also called the asterion junction right here, Asterion, because it's back, we can just think of that because it's back by the mastoid, right? Asterion junction. Okay, let's see, let's tip the bottom, let's tip it up a little bit so we can look at this occipital bone, okay? So we have the occipital protuberance, right? Or the inion, also known as the inion, the occipital protuberance that we can palpate posteriorly on the skull. All right, and we've been looking at that in some x-rays as well. You will be able to identify those in our skull images and some of our C-spine images. And these are the knuckle lines. There's a superior knuckle line. It's just the knuckle lines are a ridge of bone that extend laterally from that area of that occipital protuberance. They serve as insertion points for muscles. This is the inferior nuchal line. I tend to call it a knuckle line. I think it's really called nuchal line, the way that you pronounce it. I believe she said it here.
Inferior nuchal line.
Nuchal line, right? Okay, and then we have the external occipital crest, not really something that we palpate or really are concerned with as radiologic technologists for doing imaging, but we will talk a lot about this occipital protuberance more than anything. All right, and then we have the condyloid foramen here. I don't think, now remember the atlanto-occipital joint where C1, let me see if I can hide or fade C1. Let me just hide it. See if I can hide a little bit. I'm going to try to find those condyles here, but it's not really letting me. Yeah, those condyles where the C1, but here you can see where C1 was sitting against. Yeah, so maybe they've highlighted it here. Yeah, that's the occipital condyle there. So let me try to tip it up. Yeah, this area right here where the skull sits on C1. Remember those occipital condyles. Occipital condyles help to form the occipital atlanto-occipital joint. And I think that that's a pretty thorough example of the landmarks and some of the foramen. Let's just look at the mandible real quick. I mean, we've got it here. It's highlighted so pretty. So let's look at the parts of the mandible here. I'm going to tip it up just a little bit so we can see up underneath that zygomatic arch. So we've got the condyle of the mandible, right? Condyloid process or condyle of the mandible. There's also a neck, right? A condylar neck here where it gets more narrow. This is the mandibular notch. And then anteriorly on the mandible is the coronoid process. Posterior border of the ramus anterior border of the ramus, right? So the vertical part of our mandible is called the ramus. Then we hit the angle or the gonion, right? The angle or the gonion of the mandible. All of this should be familiar as we're talking about it. This is the whole ramus here, right? The vertical part of our mandible. And the more horizontal part of our mandible here would be considered the body of the mandible. So notice the angle or gonion of the mandible kind of separates the ramus from the body of the mandible. And then that most anterior part, the mentum or mental protuberance of the mandible. Okay, I think that does it. That's a pretty good overview of the landmarks of the skull. Thank you for watching.